All right, welcome to another episode of A to the Show, guys. Today we have Dr. Sandra Bloom. Um, Dr. Sandra, what is your claim to fame? What are the issues you're trying to solve? And how are you trying to change the world?
Big questions. My claim to fame, I think there is a frame, a meme that has a lot of meaning in the world, which I would like to lay claim to, although it was one of my best friends that said it first, not me. But it's instead of asking people what's wrong with them, we shift to what happened to you.
Mm,
And that changes everything. And
wow.
I would like to think of that. And the person that said that was a social worker who's now deceased, but he's one of my best pals. And his name was Joe Fotorero. So it was Joe in a team meeting who said that, who kind of captured what it was we had learned. And that has become a meme. Even Oprah used it. So,
Wow.
Joe didn't get any credit.
Wow.
Joe didn't get any credit, so I like to give Joe credit. What's the second question? What was the
What
second
are the
part of that?
issues are you trying to fix? And how are you trying to change the world?
Okay, they go together, hand in hand, those two questions for me. Um, I think the human species has become derailed,
Mm,
and we don't really understand how far away, how much we've diverged from our evolutionary roots, and how problematic that is now. And a lot of that, not all of it, but a lot of it is due to intergenerational trauma that
mm,
just keeps going. It's, the gift that goes on giving over and over
Hmm.
and over again, generation to generation, without people even knowing where it comes from. And so, what I'm trying to do to change the world is inform people about that knowledge. It's amazing what happens when people get it. It's amazing how much your attitudes towards yourself and other people shift when that critical question of, what's happened instead of what's wrong with you is asked and begins to be answered. So that's really what I'm trying to bring into the world and make it known in general to everybody. That's why doing something like this, where you're reaching out to people all over the world, is such an important
Hmm.
thing, because people need some kind of common framework. We need to
mm-hmm.
be able to join together and recognize that we need to we need to change the world a lot and quickly.
Right.
I agree.
And you mentioned generational trauma, which is something that is very prevalent in Lebanon. And um, we might try to show some statistics later on in the podcast. Um, so we wanted to paint a scenario for you. Um, if we dropped you in Lebanon with limited resources and knowing that the country is also like has low awareness about this field, what would be the first steps that you would take to start a change in that country?
Okay, now this is coming out of total ignorance. I have never been
Mm-hmm.
into a country that has just
Hmm.
been in generations of warfare. So
Mm-hmm.
this is from
Right.
ignorance. Um, I think what I would do is I would start with the schools. I would
Mm.
start um, delivering knowledge to the teachers, so that the teachers would be able to create classrooms that are fundamentally what we call now trauma informed, so that the children could begin to have alternative experiences, that they could begin to learn how to support each other, learn how to ask different questions, learn how to calm themselves down, um, do things that they wouldn't necessarily learn at home because their parents don't know those things. Um,
Hmm.
that's that's where I'd start. And yeah, it's a really good question, which gives me an entree to tell you about my latest
Hmm.
venture, which is related to this question. I'm the lead editor on a book that Oxford is going to put out, and it's going to be called the Oxford Handbook of Trauma Informed Social Health, and it's got
Wow.
55 chapters. And I've got them all in except 5. I'm still waiting on a couple of my best friends, who, of course, are the last to deliver. Um, but it's the idea behind it is it's broken down into the first part of it is the traumatogenic forces. What is it in our cultures that are creating trauma?
Hmm.
We didn't do one on war,
Hmm.
but we did it on uh, gender issues, sexism, racism, poverty, social inequality, and what's done to children. That's where it starts, actually. And then the second part is healthcare and mental health care. The next part is education. The next is the justice system and government. The next is the arts and community engagement, then leadership, and then research and policy. And what I've tried to do is gather people together,
Hmm.
all who have experience with these issues and can talk to other people, not as academics, not with a lot of statistics, but actually talk about their experience of what's happened to them and what they've learned as they've gone through the field. And so we're trying to make it very readable for general readers, because people are in law enforcement, they don't know anything about mental health. So it has to be readable across all of those different domains. That's what I'm trying to accomplish. We'll see once it's published. Oxford says that they might be able to get it out by next summer. So
Wow.
if I get it in, if I get my friends to get the damn thing,
Well, we're hoping it does go through for you.
so
Um,
I wanted you to know about that, because of that cross communication that's so important, and that's
mhm,
why I start with teachers.
Hmm.
Is it's not just
right.
a therapy thing; it's
Okay.
a everybody thing.
I love your work on policy. I'm very interested in all the things you've been doing to try to work with government to make change, because at the end of the day, they have the most power and resources. So let's say you were the president and you had like an executive order, and you could do something in order to like make actual huge changes. What would you do to protect children from trauma?
You're naughty. You're naughty. um, what would I do to protect children? Okay. I would do a massive public education campaign.
Mm,
I would, what is shocking to me is that the adverse childhood experiences study, well, we know, we
mhm,
know now, after 150, over 150 studies, we know that most people in America, and of course it's been replicated in other countries too, will have experienced adversity in childhood, as pretty narrowly defined.
mhm.
And a substantial proportion of them will have been exposed to a lot of it. And we know that there is a clear, definite relationship between adversity experienced in childhood and the long term health and mental health and social consequences in adulthood, throughout adulthood. We know
Right.
that now. It's not a supposition, it's not a theory, it's true. So, and yet, despite that, and that study originally came out in 1998, for heaven's sakes, most people here don't know about it.
Mhm.
I will still encounter people who are doing therapeutic work who never heard of it. It's like, I'm in public health now. I'm a psychiatrist by background, but I'm now teaching public health. And public health professionals don't necessarily know about it at all. So if I were president, where I'd start is a massive public health campaign around ACEs and what it means, and giving parents all kinds of alternative forms of discipline, of interacting with their kids, of understanding their children in ways that have not been transmitted properly across the generations. That's where I'd start. And then I would have a massive public education campaign to teach people about democracy and what it really means and how you do it in your workplace, how you do it at home, how you do it with your friends, how you do it. It's not just big D democracy in a country. The reason why it's so easy to upset democracy in governments is because we don't practice it anywhere else. So I would have a massive campaign to insist that all businesses, all communities, all practice certain skills that they can learn. That's a lot of what we're doing now in our organizational work is giving people skills. When I teach trauma-informed leadership, I give them skills to use that they can use in whatever they're doing. So in this summer, I teach trauma-informed leadership, and one of my students, who's going to have a chapter in this book I was talking about because I liked his work so much, but he's in charge of infection control in a major hospital in upstate New York. And he used all of the tools we used in class around how you have to use them if you're in charge of infection control. So I would teach that as president. I would teach that stuff to everybody. We know it. It would dramatically change situations if we could only get people to do it.
Can you please expand on that? You said trauma-informed leadership and democracy. What does democracy have to do with mental health? Sorry.
Oh, that's a really big question. Let me give you a little bit of a backdrop for where I come from, why I even arrived at that position. I was trained as a psychiatrist. Well, before I was trained as a psychiatrist, I worked on a psychiatric inpatient unit in the 1970s, I guess, late 1960s, early 70s. I'm old. And I was a psych tech. And in those days, psychiatry was very different than it is now, because those were the days of what was called social psychiatry and the democratic therapeutic community, which originated in the UK and then came over to the States. And the idea was it originated, one of the originators is a guy named Maxwell Jones. He was a psychiatrist in the UK. He ended up later in Oregon. I don't know how that happened, but what he saw, they were treating veterans of war. This might be related, Saeed, to the Lebanon question too. So they were treating men who returned from World War II. And there were huge problems with these men. Many of them were in a psychiatric setting because they had PTSD. So they were often violent to each other and aggressive with the staff. And people like Maxwell Jones said, there's got to be a better way to deal with this. And they had treated people on the front lines. So they knew it was important for these men to have a voice, to be able to determine their own way of being together, to determine what it was, what kind of treatment they needed, and what worked and what didn't. They had to have a voice in their own treatment program. And so that what emerged was what they then called the democratic therapeutic community. And what was remarkable from the point of view of the people there in the UK and here was that the violence went away. Men who were part of decision making did not go on and react violently to staff or to each other. And when they saw that, they went, that's really very important. And so by the time I was working as a psych tech and then as a psychiatric resident, that was the modus operandi for running an inpatient program in a general hospital. Open, voluntary, where the patients and the staff all talked together and formulated strategy. That's what I mean by democracy, where people have a voice in their own lives, in what is going to happen, and with each other. And that's what I experienced was normal. That's the way you did things. And we were the program I was learning this on was in at Temple Hospital, which is in one of the most violent parts of my city, Philadelphia, where there was huge poverty and guns and all kinds of violent things were happening. And yet on an open psychiatric unit, it was fine. I never experienced any violence. The only violence I experienced through my whole psychiatric training was in a psychiatric ER. I was asked to see a guy who was probably bipolar. He's probably, out of his mind. And I turned my back on him and he slammed me. No, it didn't really hurt me, but he hit me. And he was a lawyer. so, so other than that, and how is that possible? How is it possible to have a psychiatric unit with very disturbed people where you don't lock the doors and where they all have a say in what's happening to them? That's what I mean by the democratic therapeutic community. I don't think it exists anywhere anymore.
I see. From my understanding of what you're saying is that, like, these individuals and their communities, let's say they come from poor communities with hardship, they have very little control of their lives and they feel voiceless and helpless. And so they only can resort to a crime, let's say, for example. And then when you give them a voice in the democratic sense, they don't feel the need to engage in violence because they don't feel as hopeless anymore. Wow.
That's right.
I never made that connection, but great.
And it really goes back to our basic human nature, which is, we are all originally were in tribes. And tribes do not function in a hierarchical way. The original ones, that, as far as we know, I didn't live then, but as far as we know, they were non-hierarchical. And even now, if you look at certainly the Native, I know a little bit more about the Native Americans. Hierarchy is discouraged. People being arrogant and trying to push other people around is discouraged. It's probably the way it was in our original early environments. Right. And then we got way off course. Probably, they think, probably when agriculture started, probably around 4000 BC, things started to radically change. And we've been having problems.
I wanted to take your perspective on a quote I've been hearing quite a lot lately. It goes this way. It's hard times make strong men make easy times, easy times make soft men, and soft men make hard times. Now, this isn't by any say like some sort of philosopher's quote or anything, but I hear it quite often, and I wanted to see if possibly like is there any trauma experiences that are also involved within this quote itself.
A lot, I would say.
Hmm.
A lot. And, it kind of points out some of a lot of the dilemma that we're in. So if we start with the soft times, what's
Hmm.
the next part of the soft times? Soft times make soft men.
Make soft men.
Soft
Yes.
men. And you'll know what's missing from that quote, most obviously, is women. And I
That is true.
say that not to, I say that because there is good evidence that if you look at indigenous peoples, which tell us at least a little bit about who we all once were, then there was much more social equality between men and women.
Hmm.
And men were not in control of everything. They shared control because they were fundamentally more democratic. And uh, what's such a huge problem now is that women or women's qualities, they don't have to be necessarily embedded in a genetic female person. They may be in a male person, but the feelings of empathy and compassion and concern that are so much a part of what we mean by feminine are radically missing in
Mm.
many of our present cultures. Certainly over here, they're presently absent. And that's devastating because what does that do? It creates more violence because what are you going to do against a strong person who is beating you up? You got to try to defend yourself, which means you got to beat them up and you got to beat them up more. Otherwise, they'll go on beating you up. So you get into this relentless cycle of violence and vengeance that never will go away until there is a very strong, soft leader who can stop that. And they're
Mm.
rare, as we know. They, boy, do we need one now.
Mhm.
But no one's rising to the occasion yet that I can see. So, it violence, trauma causes more trauma.
Mm.
Right.
And so there has to be a way to break the cycle. And right now, what we need is much more of a integration of male and female, where you are strong and compassionate, where you don't let people do bad things, but you don't do bad things to them. And that's really tricky. That's much more, that's almost something we haven't evolved yet very much.
Hmm.
Every now and then there's a very special person who will embody those traits, but too rare to be have
What's
influence everywhere.
who's an example of like this person that you're talking about from recent history?
From recent history. uh oh, the person I admire the most is the Dalai Lama.
Mhm.
Hmm.
um but he doesn't have the power to do, but he certainly, in terms of his authenticity and his ability to look at all different sides of a point of view and integrate them. That's really what he's about, is trying to integrate knowledge.
Hmm.
That's the first person. It's the only person really that springs to my mind. Sadly, um,
It's so we're
Yeah.
severely lacking in the world, that's for sure. And it's like it's taking a toll on us. Um,
What
so
about the phrase "hard times create strong men"? Can trauma be channeled to positive outcomes?
Well, um, I was reading something yesterday. I'm strong men. When we talk about strong men,
Mm-hmm.
you may be talking about physical strength, or you may be talking about psychopaths
Okay.
who are strong because they're filled with hate. They have no empathy. They have no range of emotions other than rage. Um,
right,
and in our history, in our deep history, they they must have served a role. They're a minority of the population, um, and yet it looks like, from what I read in anthropology, that tribal people would only allow them to go so far, and then if they were so destructive, they'd get rid of them one way or another.
Mm-hmm.
Um, but that's small groups of people. Once we got big, and now we have big countries and big cities, those types of people can become in charge. They can take over. They can run companies. They can run countries because they can get away with it because nobody knows how to stop them.
Mm.
Nobody even calls it what it is. A human being that does not have empathy, there's something wrong in their brains.
Mm-hmm.
They're not okay. Human beings have empathy. That's the only way we survived, was to have empathy for each other. And without that, we're not fully human. So we should be able to at least recognize that a person that doesn't have emotions, that is, doesn't demonstrate any empathy for suffering others, there's something wrong with them. But we don't. And I think it's because of that mythology. Strong men. It means they're
Mm-hmm.
strong. No, it doesn't. It means they're ill. There's something wrong with them, and it's time we came to terms with that you can't, what if back in the day, let's say back in the day, one tribe had a psychopathic leader, and so our tribe had to have a psychopathic leader in order for us not to get killed. uh, I think that's
right,
probably how it happened. But all right, already, now what's at stake is the survival of life on the planet.
Mm-hmm.
It's
yeah,
not it's not just a couple of people. It's everybody, all the children, everywhere, no matter what race they are, no matter what country they come from. We are playing around with whether or not life is going to survive on the planet. And to have this idea that a strong man is going to somehow fix that is so unrealistic, and is trying to take us back 100 years and just pretend that these threats don't exist. So it's
right,
massive denial, and that's where we're sitting, and that's why I think helping people understand what trauma does, and how
mhm,
do we get people who are real sociopaths? How does that happen? Well, sometimes it happens because of what happens to them when they're kids. And other times they may just be born that way. We don't really know because we haven't studied it adequately. But whatever the case, you can't have those kind of people running the show, or we're all going to die.
right. I mean, I do believe that we're definitely living in troubling times, and in an era where our humanity is being tested. Um, and I think but we have reached a crucial point where people are starting to have more awareness and are starting to understand a bit more of what is happening around them. They're no longer, you know, they're no longer ignorant and no longer voluntarily being ignorant about what's happening, and they're choosing to make their voice their own opinions and actually talk about what's going on, which is I think is also has been a big surprise to the government, to their governments. You know, um, it's not something they've expected. They're trying to deal with it, and it's not. I don't think it's working. It's not working at all. So this test of our humanity is actually, I think it's been very positive. I think this is one of those hard times that we were talking about that's leading to a positive outcomes, where it's kind of uniting people together. Uh, so hopefully it just leads to more positive outcomes.
You know, there's a book. Do you know who Robert Putnam is? He wrote, uh, oh, what's his famous book? Bowling Alone.
Mm.
Years ago
Hmm.
was his most well known book. And he's written a book called Upswing. And in it, he talks about how, in the West at least, um, there was the Gilded Age, late 19th century.
Yeah.
And that was a period of um, social inequality like exists now, and that the golden age was followed then. But the problem is we got Hitler and we got World War II. But what the result of that was that people came together and people
Hmm.
said, no, we have to take care of each other. We got back in touch with our roots and said, no, we've got to do something about that. And so you get this massive swing through the first half of the 20th century towards equalizing the money, equalizing rights, equalizing healthcare, equalizing and all kinds of social programs. And then in the 60s and in the 70s, that he what he says is that started to radically and suddenly change. So he's got this upside down U that he talks about. And I haven't read the rest of the book yet. So, but what he's predicting is that that's what's happening again. That we are going through it's like the late 1900s, no,
Mm.
1800s. And then it's going to create a reaction like you're talking about. And it's in part, I think, generational. That's why I still teach, because I love watching young people, and in relation to me, you two qualify, that are getting it.
Hmm.
They're It's
Yeah.
much easier to teach them than it is to teach my own peers about all this, because they get it. They are much more readily aware of what it means. It's more like I feel like I'm giving them words for what they already know, and I'm giving them concepts and theory for what they actually sense, and that's really gratifying for me as a teacher.
I mean, that that's it. That definitely gives hope, I would say, to our generation, because I think that's something we've been looking for, we've been searching for a while. To hear that this tough time is a good test for us to, and then out of it comes like a golden era, which uh, which is great, because I think that also highlights like an evolution of our society. It's like when these times happen, they teach us lessons that we never haven't thought of
Yes,
before, we haven't really experienced before, and when we are aware of them and we learn from them, this goes on for future generations, because when we experience them, we teach them to the next generation, and they get inscribed into our education systems, like the school, like the policies you're saying, like the first steps to do is to work in the schools and teach the kids like this is how it should be done, how things should be
right,
approached.
exactly, exactly. And I think I recently read this book called The Nordic Theory of Everything. And
Hmm.
I can't remember the author's name, but it's a wonderful book because she is Finnish, and she came over, fell in love with an American, and they got married, and she lives here now. And she talks, so she's experienced my culture, and she then shows the differences between, what happens if you're a mother and you get 2 weeks leave versus you're a mother and you get a year leave to be with your baby, and the
Right.
father gets special time too. And then childcare is quality childcare with at least a master's degree person who's actually doing the childcare, and that's free. And healthcare, it's free, and kids get to go to college for free all the way through. And you go, and if you're an American, you go, well, what the hell? And then you'll hear this crap about, oh, but they pay such high taxes. Hey, we pay really
Me
high
too.
taxes.
Yeah.
Yeah, exactly. I mean, and what do we get for it, right? So I think it's also really important for the next generations to be able to think outside of the box,
Mhm.
and there's no
Yeah.
reason why we have to go on living the way we're living. We're being manipulated in order for a small proportion of people to make a lot of money, and they're still miserable. I mean, money doesn't bring you happiness, does it? So, you know, we're all being manipulated to believe it's the only way it could be, and we need to be able to fantasize about, well, what if elder care was taken care of, and healthcare was taken care of, and education was taken care of, and adults didn't have to go into massive debt to make sure their kids got what they needed, or their elders got what they needed. Wow, that would be pretty cool. You got to get people thinking about that. Got to have them imagining something different than what we have, because I think any kind of change begins with imagination.
Wow, that's so true. Um, Let me focus on you talking about money doesn't bring you happiness. Does Is poverty something that brings you trauma? And maybe we can dive a bit deeper into the situation in Lebanon. I have some statistics that 75% of people in Lebanon are considered poor and poverty, especially because of an inflation situation. There's hundreds of thousands of people who've been displaced, thousands and hundreds who've been um, killed or injured in war recently, and half the population has PTSD from war. So those are just some stats that I wanted to share with you. And when me and Said were talking about this situation, he was telling me that I was. He was like, "Yeah, but Lebanon has resilience. So even if you are poor, it doesn't mean that you're going to be suffering because we take care of each other, and there's the social um, aspect where people come together to help each other out that decreases negative outcomes." But I was telling him that as much as we help each other, we still have this huge environmental factor to deal with. So, um, can you tell us more about resilience?
I'll first tell you, I don't really like the word resilience.
Mm-hmm.
And I don't like it because the way I learned what it meant from the beginning, not having nothing to do with what we're talking about, was that it's metal that bounces back. Right? That's a
Mm-hmm.
and that's why I don't like the word, although I know it's being used in much broader sense. So I respect that, but I just don't like it because that's my original understanding of the word. Because I've never seen anybody who's been experienced a true trauma bounce back. Now, that's why I prefer the word post traumatic growth,
Mm-hmm.
that I have seen thousands
Mm.
of people grow after a trauma, grow, transform, change, blossom. You can use a lot of words. but I don't like bouncing back. so,
Fair.
so, right. So yes, I think that, absolutely. What will happen, if there's not more war, um, is that, and it'll be generationally too. It's what you were talking about the next generation, because the next generations are going to want to do something different. They're not going to want to do the same things that have already happened. So that means trying to create situations where people have an opportunity to grow, to change, to do things different. Now, how does that happen? You can't, it's not possible. When you have a whole huge population of traumatized people, you can't prescribe psychotherapy as the answer, right? It's, you don't have
Yeah.
enough, there's just not enough resource. So you have to be thinking about whole community measures, that can be put into place, and with a lot of diversity, because different people are going to respond to different things. So, things like, yeah, on my program, I had a program to treat trauma survivors for 20 years, and I'm trying to add up how many years it was. And um, we had an open democratic therapeutic community that we treated them on briefly. They were in ideally 2 or 3 weeks. That was it. Then they went to outpatient treatment. But we used a lot of art therapy, psychodrama, and movement therapy. So all of the nonverbal therapies that are more likely you're going to have resources in a place like Lebanon for people who are already doing that work, where that could be supported and promoted, right? To get people into group settings where natural post traumatic growth can occur. Encouraging people who don't want to be in a group to keep a journal, to write. Writing helps people to grow. It helps people work through when they don't have anybody else to talk to. They're talking to themselves. Just make sure they read what they write. There are things that are probably that you guys probably know more of because you know the culture of Lebanon, that are part of the cultural experience that can be accentuated, and supported to help people grow after. And it doesn't much matter how they grow, just that they move. It's, the hallmark of trauma is that people get stuck. They just keep repeating the same thing over and over and over, often very problematic things that are self-destructive. So if you think then, okay, then the goal, we have to create, situations where people have an opportunity to do something different. Doesn't necessarily, you don't have to define what the something different is. Just get them moving, is going to help, populations do something, different. And I think a lot of the community engagement work is around that. So one of the chapters in this book I'm doing is, by Laura Porter and Christine Cole, who works with, and they do work with Rob Anda, who did the original ACEs study. And they are doing what's called self-healing community work. So they go into a small town, right? And do an assessment and figure out what's happened to the people there, and then try to get the people talking to each other. What do we need? What, rather than imposing it from outside, having the change process be generated from the inside. And then another chapter in this book is going to be by, Casey O'Donnell, who has been working. We have a part of Philadelphia, that is, it was a highly industrialized part of the city. And then when deindustrialization happened, all the jobs were gone, leaving people in poverty. And it has been the most drug infested, with, homeless people living in tents or just on the street. I mean, horrible crime, horrible, horrible, horrible. And Casey O'Donnell and his pals have been working, with that community, um, for years now, with the community
Mhm.
members who are not drug addicted necessarily, to try to reclaim that part of the city, and getting them to talk about how do they do it, not imposed from city government, but generated up from the bottom. I think it's all of that's why I'm doing this book. I want to get this kind of information out there, and these kinds of examples of how do you reclaim this territory when you've got a whole city that's traumatized,
Mm-hmm.
you have a whole country that's
Mm-hmm.
traumatized. Where do we start? What do we do? Well, you got to get people to have hope. They have to know that post traumatic growth is where we got to go, but that means we got to do things differently. Got to look at what we did that got us into this mess and what this mess is about, and then start hypothesizing about some things that might be different that might get us out of this mess. And that can't come from somebody like me. I mean, there are some things I know, but I don't live in Lebanon. I have not, thank God, had to live in a war torn area, right? That's a whole other thing. And so it has to be, there's some basic notions that we know are really important for trauma healing, but it has to come from the people. It has to come from the bottom up.
Mhm. Something that I've noticed that, especially in Arab cultures, is they still are struggling with the idea of therapy and like listening to going to a therapist, accepting psychology as this revolutionary science that could help them. Um, like if I try to talk to my parents about some sort of like mental illness or whatever is the situation, they usually look at it as like the extremes. So let's say I was talking to them about the concept of autism. Um, and the cases that they are aware of are the ones that are very extreme. They don't understand that there might be different levels, different. Um, it's like it is a spectrum, and they're still they're still rigid on these topics. So, from your perspective, how do you educate the older generations? Like, how do you educate the parents, the grandparents? How do you get through to them so that they can also support and help the younger generation? Because in the end, they're the ones with the more power. They have
Yeah.
the more resources.
Um, well, I think here, what has been helpful in that regard has been the brain stuff. So the knowledge about the brain and how it works. And I think it's just beginning though. So I mean, we still have such a long way to go to get
Yeah.
across to the older generation the impact of childhood adversity, because so many of them will have been exposed to it,
Mm-hmm.
right?
Hmm.
And because they will have done things to their children that then they can feel guilty about, which you don't, that's not going to help, right? But that's what happens. Um, so that's why the intergenerational conversation becomes important, because we have to help people see, no, but this is, we've been taught for a couple thousand years that, what you should do with disobedient children is to punish them. And so, but that turns out to really do damage to children's bodies and brains that can last a lifetime for them. And we didn't know that. And now we know that. So it's kind of like it's a big push, but
Right.
there will be a certain proportion of the population that get that and that are willing to deal with it. And eventually the ones that don't will die off. I mean,
Right.
that's how change happens in humanity, right? Is that
Survival of the fittest style.
what? Huh?
I was saying
I,
survival of the fittest style, but in this case, it's more of like mental psychology and mental habits. So,
yes, yes.
speaking of disobedient children, because this exists in like Lebanese culture where you teach your child obedience, whether through or discipline, whether through hitting them or yelling at them, and for sure this definitely causes trauma. So what would be an alternative method or technique to uh, discipline a child, or like tell them, stop being so disobedient?
I think what parents are learning to do. I'm not a parent myself, so I don't want to come across
Hmm.
as being an expert in this. But I live next door. I'm watching three, a 5 year old, a 3 year old, and a 1 year old. And they're in good shape financially. The mother has all the time in the world to spend with her kids. She's not working outside of the home right now. So I'm watching an ideal, that kind of
Hmm.
situation where there's plenty of
Right.
time, plenty of money, and how she's managing that. And it's really interesting to watch because the oldest little boy, she says he's autistic, although if he is, he's one of those very high achieving autistic kids. He's very bright
Right.
and he's personable. Um, and how she is managing them without yelling, without hitting, without doing any of those things by she's very honest with them about what she needs from them and how they have to be and what the consequences will be if they don't follow through. It's a lot of reasoning even with young children because we've probably been grossly underestimating how much children can understand. That
Right.
they understand things long before they can actually talk about it. And so kids don't want their parents to be upset with them. And so there's all kinds of ways of letting your children know that no, that is not to be, and that makes me unhappy when you do that, and this is the boundary and this is the consequence. But it doesn't have to be hitting them. It doesn't have to be
Right.
bringing out a belt. It doesn't have to be doing any of that. It doesn't mean that you have human beings have to learn how to manage ourselves. And so their
Hmm.
responsibility as parents is to make sure that their kids can be out in the world and be safe. And children don't know any of that yet. So they do have to learn. It's not a matter of that. But I think it has a lot to do with respect and respecting children for who they are
Right.
and thinking about how you'd like to be treated, and treating your kids that way. And because that's what they're learning and that's what they're going to
Hmm.
convey to the next generation. So I think there's probably some very much better people at this than me. But I'm watching this and I'm really it's so different than what I've seen. But it's the way my parents treated me. My parents treated me with I was born really cross-eyed, and I started having glasses when I was 18 months old, and my
Wow.
first surgery when I was 3.
Oh.
Um, and uh, uh, my parents were wonderful. They treated me with respect. They talked to me. They would tell me what was going to happen and what wasn't going to happen. Um, and I never, until I was an adolescent, and then things really went to hell. But as a kid,
Yeah.
and that was part of what I rebelled so much about as an adolescent, because I was so accustomed to my parents
Hmm.
listening to me and respecting me and honoring what I said, and did,
Right.
that when they got scared, they got really scared. Actually, I think my mother got triggered, and they suddenly changed, and that really threw me off for a long time. That I needed therapy for.
Hmm.
So yeah, I mean, I think it's possible, but it does
Right.
often mean not doing the same thing that was done to you.
Right, and learning
Okay.
from like what happened to you. A lot of people don't have that awareness, and a lot of people have their own traumas and their own things they're dealing with, and so now they have to work with a kid, and like
Right?
they don't want to be so reactive or so emotional or impulsive or yell or
Don't know
hit,
how.
but it's sometimes just instinct. And I think a lot of we need to take care of ourselves and work on our post-traumatic growth before we work with others that are going through it. What do you say?
Yep.
Yeah.
Yep. And letting educating people to know what it means to be triggered. What that looks like, even if they don't know what they're being triggered by. Um, to know that, wow, I am overreacting to this
Hmm.
situation. I am more upset than I should be. It's just to be able to know that is an improvement.
I wanted to pivot a bit and ask you about social media and the effect it's having on our brains when it comes to um, like seeing very violent images online. It's becoming very common, and we all have access to the news and to journalists, and we're becoming educated. And but at the same time, we're like overwhelmed with so many images of violence from all around the world, and I think we've become so desensitized to it. So what is that doing to us in our brains?
Yeah, I think you already know. It's not good. Um, it it it. I think there's no real balance. So we're getting hyper aroused to how awful the world is, without the balancing reality of, well, that's actually not the way most people treat each other all the time. And so that's going to make us more paranoid, more scared of each other, more. And you know what else is? Thinking that we can communicate everything with each other through email and text. I, I'm aware of a situation in my neighborhood where there's two people who live next door to each other, who are in a significant conflict with each other for the last year, and they have not spoken to each other except through text and email. And one of them called me, and I said, stop texting and stop emailing. Call your neighbor up and make a time to talk to each other. So that's all part of it. It's all wrapped up. The computers are amazing and wonderful, and I do all my teaching online. But at the same time, like anything else, they're going to be a huge handicap.
Hmm.
And they are doing bad things to our brain, because they're I limit. I mean, I really limit my exposure, because I got other things to do. And if I get too negative and too paranoid, I can't convey anything except that. And then I become toxic, right? So it's really about reducing, we think about different levels of stress, and a lot of what we get exposed to on the media is really toxic to us. And yet there's absolutely nothing you can do about it. I mean, you're you're an audience, but you can't change it. You can't stop it. You can't do anything except, oh, another horrible thing that happened, and another horrible thing, and another horrible thing. So, in that way, I think it's really toxic. And I think people have to be strategic about the dose that they give to themselves, and how
Right.
they dose themselves. I think it's just kind of a personal responsibility that we each have to protect what we have to offer. And that, what's our mission? What are we here to do? And is this going to help us fulfill our mission, or is this going to get in the way of me fulfilling my mission? And that's, I think, a critical question.
Right. I mean, it also goes back down to like the habits that you have surrounding the device. You know, you don't want to create a negative habit where you're constantly using it as like a stress reliever, for example. Because I feel like our generation um, use technology as a stress relief or a coping mechanism, or like dopamine hits, quick dopamine hits. So what's I mean, what would be the solution for people who are addicted to these devices? How would they, get rid of them? How would they find alternative sources of stress release so that they can reduce their screen time at least?
That's a really good question. I mean, I guess it would be like any other addiction. You have to withdraw. There's no shortcut. If you're hooked on heroin, you can't just reduce, your amount of heroin. You gotta stop the drug. Um, and so, you make a really good point. The people getting a dopamine hit off of something,
Yeah.
particularly if it's something violent.
Hmm.
Well, they have to come to a conscious recognition that this is not good for me. This is just not, and probably by talking to other people who have withdrawn. That's where,
Hmm.
why is AA so effective for alcoholics? It's the only thing that's ever actually really consistently worked for people who are alcoholics, is
Hmm.
groups of people who go, I'm an alcoholic and this is what I'm doing now in my life, right? So I don't think it's probably not going to be any different for any addiction, that you
Right.
need to be around other people who have said, wow, this is really toxic for me. I'm stopping it. You should stop it too. Um, and that would, if enough people stopped, that, that would have an impact on the quality and nature of what happens on social media.
So
You know,
does the group thing have like a type of, is it like a source of validation for the individual? And to add to that point, is that like validation from others, like something we should look at in a positive way and not a negative way? Because some people would say that if you're seeking validation, then that's actually a negative thing to be doing. But in reality, it could also be a positive thing if it's in like
sure.
in this
If you're
pretext.
doing something negative to begin with, right? Then getting it's, if you've ever worked with anybody who's been in AA, they go through stages and
Yeah.
eventually become a sponsor themselves, right? So it's I think that we all need connection.
Hmm.
Right.
Um, uh, so yeah, you can call it validation, but it's really about connection and not feeling so
True.
alone, and feeling and having a sense of meaning and purpose, which is missing for a lot of people. They don't. There A lot of people are working in jobs they find meaningless. They don't really know what they're here to do. They haven't found what their purpose is, and human beings need that. We need those more spiritual level experiences of why we're here and what we're here to do. And I think people who are addicted have lost their way. They've gotten hooked. They've got, they're off the path, and they need to get back onto the path. And doing that with somebody else who's been off the same path is an easier way than somebody just telling you, well, you should stop social media, or you should stop drinking. That I, if I can say I know what it's like and I know what it's given you, but what it's giving you is driving you down a bad path. And I know, because I've been down that path. It's a whole different conversation. Right. And that's why people coming together, I think, with common issues is so important. Um, it's about connection. It's about not feeling alone, and seeing how other people deal with the kinds of problems you're up against is really helpful.
Yeah, it is.
You've seen a lot of dark things in juvenile prisons and the field of trauma. What do you do to take care of yourself, and what keeps you going?
Uh, I have 2 dogs. uh, they keep me going. Writing keeps me going. Um, and I feel I'm very fortunate, and then I feel a real sense of purpose and meaning to all of this. I think this understanding about trauma and adversity and what it has done to us, not just to individuals, but to us as a species. I get that now. And, I fill in the pieces of that with everything I read and learn. Um, and constantly learning keeps me going. Um, that that's really important to me, is that, it's another piece of that. No, and that it's another thing that makes sense, and tying it together at all levels. Um, and I gave up doing clinical one-to-one work
Mm,
and changed to working with organizations, because uh, it was so frustrating to keep treating people who never should have been hurt in the first place, um, and systems where they were still being hurt. So I needed to go to the system level, and that's just kept pushing me up and up and up and out, which is where this book comes in, right?
mhm.
Is and that's been my work for the last, since for last 30 years, I guess, is really training organizations of, what does it mean to be a trauma informed organization. And it started with the sanctuary model, and now it's extended now to what I call creating presence, which is a online organizational approach to take a whole staff of people. And it can be in mental health or education. We just did a whole bunch of an educational systems in Pennsylvania, to help them become trauma informed. And a colleague of mine has done a lot of work, similarly with prisons and the justice system,
Mhm.
trying to help the justice system become trauma informed, which, as you can imagine, is an upward, that's an
Yes.
upward, but you've got a prison and you've got a whole population of very traumatized people, by definition,
Right.
who are not getting any help. So yeah, there's a lot of work to be done. I'm not bored.
I want to circle back to something you said in the beginning. The last topic I want to talk to you about is trauma informed classrooms. You brought it up a few times. So, what are the things? What would that classroom look like? What are the things we'd be teaching kids um, to help with post traumatic growth?
Yeah. Um, the teachers would be taught first, right? You would get the teachers to understand how their children's problematic behavior is related to things that have happened to them and what the symptoms in children look like, because kids can't necessarily talk about it, right?
Mm-hmm.
They're acting it out. And then you create an environment in the classroom where children learn words for their feelings, right? There's a lot of emphasis in the classroom on safety. We have this thing we call self. It stands for safety, emotions, loss, and future. So the teacher then is prepared to do a lot of work from the very beginning of what it means to be safe, and gets the children to buy in doing that together. What does it feel like to be safe? What do you need to be safe? And make sure they have whatever it requires them to be safe. And then the teacher starts talking about their emotions and what they feel, and has skills to talk about that with kids when there's an emotionally arousing circumstance. And then loss is really tricky because, oh, when a child loses a friend or a child loses anything, right? There's bad feelings are aroused. The teacher has to be prepared to know how to deal with that. And all of these circumstances, when the child violates them, would usually be punishment.
Mm-hmm.
And instead, there's conversation. There's, what can I do to help? There's, you look to me like you're not feeling safe, Jimmy. What do you need to feel safe right now so you can study again so we can get back to the lesson? It's a completely different frame of mind that the teacher comes from, that then has to be integrated into the classroom in however, and they come up with all kinds of creative stuff. We have the people who manage creating presence for me also run 3 alternative schools. So all of the public schools around here send their problem kids to their schools. And they have things like, they have dogs in every classroom that comfort the kids. They have all kinds of things they've devised for the classrooms to help these kids to heal and then get back into public school, hopefully.
Mm-hmm.
So we know a lot now about how to have trauma informed classrooms and trauma informed schools, but it begins with the grown-ups.
So true, right? Yeah, I think all these skills you talk about also help with like conflict resolution, since
Yes.
us as people, we're so conflict oriented. Like, you can't leave us in the office for too long before we start arguing about something. So
Yep.
if we
Yes.
can if we can learn how to de-escalate conflict, I
Exactly.
think
And
that's a
that's
huge
and
skill.
that's what we're doing with creating presence. It's really
Mm-hmm.
all about skills for conflict management, for doing complex thinking, for managing emotions, for creating safety. That's really what it's all about. And we all need tools to do that because it doesn't just come naturally anymore. Maybe, thousands of years ago, we knew how to do it, but we've forgotten.
Mm-hmm.
And we
All
have to
right.
recover a lot of that.
Um, I have just one more thing to ask about, and this is more of like from a personal experience. I'm currently having, say, I'm struggling with communication with one of my friends, and I'm a bit confused about what's exactly is happening. So from their side, lately they've been complaining on like different instances about maybe like small things about me. Like I can say from our last conversation, he was calling me passive aggressive, and he mentioned 2 instances where I was, from his perspective, it was passive aggression. from my perspective, I wasn't being passive aggressive. This is me maybe um, highlighting, saying my observations out loud the moment he has a reaction. So, for
Mm.
example, in one of those instances he mentions is I we were talking about something and then he jokingly reacted, slightly overreacted, but in a joking manner that um, I shouldn't be talking about him like that. Then I told him directly, um, a bit in a serious manner, like, don't take it too personal. Um, he took that. I think he did take it personal when I said that, and then he later on mentioned on the side that this is what happened. And then there was another instance as well. But anyway, I forgot, to be honest, exactly the details of the second part. Something that I did struggle with understanding was if I am being a jerk or if he's being maybe a bit too sensitive. And from what I was able to really put it down to, I think it's a bit of both. Maybe there's a bit of a struggle with my communication style. Like maybe my types of jokes are a bit, you know, they're a bit too near to the truth. Maybe he's taking those too personal. That's what I'm worried about. It's like he's taking them too personal, he's taking it too much to heart because they might be right, and he doesn't know how to deal with them. That's my perspective. From his perspective, he sees it as passive aggression, and this is not how friends treat each other. I'm the type of person who's pretty direct and is very honest about things, about what I see at least. So, any what would you advise in that situation? Like,
Is
what's
this been
going?
going on for a long time?
It's been happening recently. Maybe I would say it started about a month ago, maybe. Maybe there was a bit of symptoms earlier, but like recently it's been a bit much more. Like he's just been complaining. I don't have anything to complain about, to be honest. Um, like and I told him like this is how I am. If you don't like it, maybe we should take a break from each other and stop talking for a bit. Um, this is just who I am. That's my perspective.
I
So I don't know
guess
what's going on from his side.
what I would wonder about is how long have you been friends?
I would say around a year, but we've been talking to each other like almost on a daily basis.
Okay, so I would wonder if I were you, what
Hmm.
else could this be about? What if we're not actually getting to what the issue is? And the all of
Right.
this stuff is actually concealing what's really bugging one or both of us. Did something
Hmm.
else happen that I'm not aware of? And it's really hard to talk about or think about. I would just I'd look for something else because this isn't, as you already know, it isn't making a lot of
Yeah.
sense, right? And that makes me kind of suspicious that you haven't yet gotten to the root of the issue.
Hmm.
Um, I don't know if this would help, but there is a method that we use for complex problems
Right.
to try to wrestle with them a little bit, and it's called the six hats technique,
Okay.
um, and it's um, both people, or if you're in a group, all people put on one hat at a time, and the we switched the names of the hats from this. The guy that made this up was a guy named Edward de Bono, and
Hmm.
he used a white hat and a black hat as the first hats, and we switched that when we started to use it at presents because here talking about white and black is, triggering, right?
Yes.
So we made them purple and pink. So but nonetheless, so the purple hat is about facts. What are the facts? And you don't talk about feelings. You don't talk about anything else other than we have a problem. What do we know that are facts about this problem? And then the pink hat, formerly the black hat, was what are the worst aspects of this problem? What could go really, really? No, I'm wrong. Wait, the next hat is the red hat. The red hat is the feelings. What are the feelings that are aroused? So, in what you've been talking about, I feel hurt because you're being passive aggressive, he says, and you say, well, no, I'm not being, I'm just saying what I feel, right? The next one then is the black hat, and that's, well, what's the worst possible outcome that could happen? Well, we could stop being friends. We could stop talking to each other. What's the yellow hat is the optimism. What is if we have this conversation and we work this out, what is the possible most positive outcome that we could have? And then the blue hat is no, the next one's the green hat, and the green hat is creative, out of the box, wacky ideas. We get a balloon and we both get on the balloon and we travel across the Sahara Desert in the balloon. It doesn't matter what can you still see me?
Yes,
Okay.
yes, of course. You're
Yes,
good.
yes.
All right. I've lost you. Wait a minute. There you were. Okay.
We're right here.
Okay. And then
It's okay. We can see you.
now I got you back. And then the blue hat is where you put it all together. And by the time if it's a group of people, I've never actually done this with just two people, but if it's a group of people, by the time the whole group gets to, because you have to really be very strict along the way that you don't let feelings like come into the facts. You keep them separate. And then by the time you get to the blue hat, people are laughing and they're like, oh, well, I guess we sorted that out. I guess we know what we're going to do next. I mean, it's kind of a fun way. And, especially when you're in a group, you actually get the different color hats and it's ridiculous and it's fun. So, maybe, you might just use that with your friend just to it would take the conversation in a completely different path. And maybe you'll be able to get to whatever is really troubling your friend, because I don't think that's become clear yet. Something's bothering him. It's a guy. Something's bothering him, and he may not have words for it yet, and this might help him at least come to some words for it. You have to let me know.
Right. I'll try it with him. I'll see if he's up for it, whether today or tomorrow. Thank you again, Dr. Bloom. You've been amazing, to be honest. The wealth of knowledge that you've been sharing with us, and you're sharing to the many generations that have passed, has been fantastic. Like, I don't know what more to say, but thank you again. Thank you for what you've done, what you are doing. Hopefully, the people that are watching this are definitely learning. And
yeah, you know what?
I guess
I have there's
yeah.
a whole lot of podcasts that my colleague Sarah Yanissi and I did for Creating Presence. It's on YouTube.
Okay,
so they can
Fantastic.
just put in creatingpresence.net's our website, and you can find them on YouTube. So please do.
Excellent.
Thank you very
Definitely.
much.
We'll put
Thank
a
you
link
both.
definitely for
It's
the
really
description.
okay. That'd be great, and it's really fun to be with both of you. So thank you for inviting me, and good
Thank
luck
you
with
again.
your work. Keep it up. Yay.
Yes.
Thank you.
To a better future. Let's do it.
Yeah, exactly.
Thank you guys for watching another
Let's
episode.
do it.
We'll see you guys later.
We're out.
Peace.
Woo.